CanChild Center for Childhood Disability Research focuses on families. We help children's treatment centers and programs understand family-centered service and how it can be put into practice. What does this mean? Family-centered service is an approach to providing services to families who have children with complicated lives. Family-centered service means we ask about and respect the needs and perspectives of the family first, and put them first. We support families and healthcare professionals working together in a partnership that benefits everyone. How do we know what works for families when they are in partnership with healthcare professionals? As researchers, we are interested in exploring parents' experiences of family-centered services. How do we do this? We created a questionnaire called the Measure of Processes of Care, or MPOC. MPOC is a tool that allows families to share their perceptions of the care they have been receiving from healthcare organizations and the people that provide services to their child. MPOC was developed with families. What does this mean? It means that when creating the questions, families helped us both to identify what aspects of services they thought were important and to give hundreds of examples of the kinds of things we should be thinking and asking about. MPOC has 20 questions. It asks families to rate the behaviors of the healthcare professionals working directly with the child. What are some examples of the questions MPOC asks? To what extent do the people who work with you or your child 1. Fully explain treatment options to you. 2. Have information available to you. 3. Provide enough time so you don't feel rushed. Families respond to the questions on a 7-point scale, ranging from not at all to a great extent. Higher scores mean a family experienced more family-centered service. At CanChild, we have strong evidence that families who report higher scores on MPOC are also more satisfied with their services, have better mental health, and experience less stress in dealing with the services they and their children receive. Gathering families' responses to the MPOC allows a child's treatment center or other program to look at the patterns of scores and to identify both what they are doing well and where there is room for improvement. Responses can and do change the way services are provided to families and their children. Sharing experiences is an opportunity for families to help create change. At CanChild, family-centered also means we protect everything families tell us on the MPOC. What kind of protection are we talking about? Families' responses are confidential and anonymous. We do not try to connect what a family member says to a particular therapist or doctor. Instead, we are looking at the big picture of the services provided to families. CanChild puts families at the center of everything we do. MPOC is only one example of the many ways we are working with families to further strengthen the partnerships they have with healthcare professionals. CanChild listens to families to better our research. To learn more about MPOC and some of our other work, check out our website at canchild.ca.